Okay. Good morning. Thank you for joining us today. I'll start with an important announcement regarding the format of these EpiCH webinars. Given the sensitivity of many of the topics that are discussed this semester, and actually some complaints with regard to an earlier seminar, we're making some changes to our formatting. So we're going to be using the Zoom webinar format rather than the Zoom meeting, which is going to be a little bit easier to control dialogues and things like that. So if you're someone who doesn't speak out or ask questions, we invite you to do so during the discussion period following the presentation. So you can use the Zoom button, and you can also, to raise your hand, there's a Zoom button to raise your hand, or typing in the chat box and we can read your question. If you're someone who tends to contribute a lot, we ask you to monitor your comments, listen more, let others speak. If you find yourself really disagreeing with what's being said, we ask you to try to listen even harder. I'll do my best as the moderator to monitor the conversations. So our speaker today, we're really fortunate to have Minnesota Representative Ruth Richardson. She represents District 52B in the Minnesota House of Representatives. Representative Richardson is also the Chief Executive Officer of Wayside Recovery Center, and that's an organization that provides substance use help to people with mental health treatment for women. She holds a BA from the University of Minnesota and a JD from William Mitchell College of Law. Representative Richardson is the chief author of a House resolution which was passed declaring racism a statewide public health crisis in Minnesota. She's going to talk to us today about how public health leaders can work together with legislators to dismantle racism in Minnesota. Thank you for joining us.
Thank you, Mark, for the introduction. I'm going to take a moment here to try to share my screen. Good morning, everyone, and thank you for joining us. And I appreciate the opportunity to talk about racism being a public health crisis and how we can all work together to create community-based responses to addressing systemic racism within our systems. As alluded to, racism can be a very difficult conversation to talk about. It can be very uncomfortable. And I think it's worth noting that one of the reasons that talking about racism can be so uncomfortable is that it's a reflection and indication that something is deeply wrong. If there were not issues, this would be a much easier conversation to have. And so as we go into today's conversation, there may be moments or times where you feel discomfort or you feel uncomfortable with the content of the conversation. And I think it's really important to understand for BIPOC communities, Black, Indigenous, and people of color, when it comes to systemic racism, microaggressions and macroaggressions, that's a standard part of life. It's not something that you can sort of opt into and opt out of. But when we're talking about the discomfort of talking about racism, you have the ability to sort of lean into the discomfort or to push back. And so as discussed earlier, I think it would be very helpful if you start to feel sort of that discomfort to really lean into that. And that's just going to be a request that I have of everyone on the call today. So I wanted to start with just setting a little bit of context of how we got to the pathway in 2020 of declaring racism a public health crisis in Minnesota. Early in the year, we were all very shook to the core with the COVID pandemic. And with COVID, it began to shine a bright light on health inequities that have been persistent within our systems for decades, and health outcomes that have been full of disparities. And I like to say that COVID shined a bright light on health inequities, including access to care and also outcomes of care as well. And at the state legislature, when we were faced with the COVID pandemic, it changed the trajectory of our entire session. We were moving forward with a number of bills, the pandemic struck, and everything at the legislature shifted very quickly. What we began to focus on was the pandemic 100%. The governor's office, the House, the Senate, that was the focus. And the focus was because it was clear to everyone that COVID was a public health crisis, and there were huge risks associated with that. And so as a result, we stopped everything in the legislature to focus exclusively on addressing COVID. Everything from access to testing to creating pathways for businesses to move to telemedicine and telehealth, and a whole host of other decisions were made, and that was the focus. In the midst of the COVID pandemic, when in many ways the world had stopped, there was the tragic killing of George Floyd. And it caught not only the attention of everyone in Minnesota, but nationally as well. And with that, what really happened in the aftermath of the COVID pandemic and the tragic killing of George Floyd was a conversation that was happening not only on a statewide level, but on a national level, and really thinking about the impacts of race, thinking about the impacts of racism. And with that, it created sort of this perfect storm for 2020 being a year of racial reckoning. And one of the things that I just want to share is that when we think about racism, when we think about systemic racism and the issues that we face, not only in Minnesota, but nationally as well, these are not new issues. These are not issues that just happened, in 2020. We're talking about centuries of policies, centuries of actions that have resulted in disproportionate impact, negative impact on Black, Indigenous, and people of color in terms of outcomes. And so as we begin to have more of these conversations about the impact of race and racism, it's really important to note that we are grappling with a problem that is over 400 years old within the United States. And as a result of that, there's a lot of work to be done, and that's not going to be undone with a single session, with a single House resolution. So everything that we have done so far are really just the early first steps. I wanted to start with just a quick overview about the definition of racism. And the definition on the screen is one that comes from Dr. Kamara Jones, who's well regarded in the field and has decades of experience. And when you think about what is racism, this definition breaks it down in a few different ways. First, racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities. And the important takeaway from that first part of the definition is that it's based on social interpretation. Race in and of itself is a social construct. It is something that was created, much like time. Time is a social construct. It's something that has been created. But when you're thinking about it from the perspective of racism, that social interpretation, that social construct has results that have people experiencing disadvantages from the way that they look, and individuals also experiencing advantages from the way that they look. And the final part of the definition talks about the waste of resources and how racism saps the strength of the whole society through the waste of human resources. And as we get into today's discussion, we're going to talk a little bit more about the fact that racism is not only a public health crisis, but it's an economic crisis as well. And it is one that is very expensive. So when we talk about systemic racism, there are sometimes people who will talk about the system in terms of, you know, the challenges that we have are because we have a broken system. And I like to take a step back from that and remind people that the system itself is not broken. The system is working just the way that it was designed to work. There have been policy decisions made. There have been, you know, laws passed that people had an input in designing the system. So when we look at the outcomes that we're seeing, it is a basis of decisions that were made and decisions that were maintained to get to the outcomes that we are seeing at the other side. And one of the challenges within any system of design, when you're thinking about it from the perspective of disparities or inequities, it is the discretion that is built into our systems that can oftentimes be the root of those unfair advantages or disadvantages. And as we talk through for the next few minutes, I'm going to give you some examples of health inequities and health disparities, and also we'll talk through how discretion plays a role. So again, when we think about the outcomes that we are seeing, we have to be reminded that it is based upon the design of the systems we have. It's based upon the fact that people in power have made decisions that determine how resources are going to be allocated, how care is going to be provided, and so on. So I want to start with sharing just an example of one of the persistent and also unacceptable health disparities that we are seeing, and thinking of this with a lens on racism and the impact. In the United States, Black women are 3 to 4 times more likely to die during pregnancy and to die during childbirth. And when you look at the research and the data, because there is a lot of data out there, when you control for things such as diet, general health, you can control for socioeconomic status, education status. You can also control for income, access to healthcare, access to housing. At every single level, Black women are more likely to die during childbirth and during pregnancy. And when you look at the birth outcomes for a Black woman who is college educated with a high income, her birth outcomes look worse than a white woman's who didn't finish high school. So this is not a situation of, well, if people just had access to health care or health insurance, this is going to change. Or if people just had access to prenatal care, this is going to change. And what's really disturbing when we think about that deep of a disparity, being 3 to 4 times more likely to die during pregnancy and childbirth, what's deeply disturbing is that 60% of those deaths are preventable. And so when you're thinking about the fact that the majority of women who are dying during pregnancy and during childbirth, that those deaths could be prevented, it's another indication of what are the issues that are seriously wrong. And this disparity is not a new one. This is one that has existed for decades, but it took on sort of new, sort of a light has been shined on this issue because there have been a number of high-profile Black women who have died during pregnancy or who have almost died during pregnancy that have shed a light on this. Beyonce is one, Serena Williams. People who are very successful, have access to the best care in the world, and they are still experiencing these disparities. Now, we talked a little bit about the maternal impact. I want to talk a little bit about the looking at the infant mortality statistics and rates. Black infants are twice as likely when compared to white infants to die before their first birthday. And there's some very sort of disturbing research that is coming out of the university right now, work that Dr. Rachel Hardiman has been working on, looking at infant mortality and looking at the difference in infant mortality based upon whether an infant has a Black doctor or a white doctor. And what was really surprising is when that research began to show that when an infant is served by, a Black infant is served by a Black doctor, you're seeing dramatic decreases in that infant mortality rate. Another really concerning and shocking reality is that the current infant mortality rates for Black infants right now in 2020 are worse than the rates that we were seeing in the 1850s during chattel slavery. That's a really stark reminder of just how deep these disparities run. To have birth outcomes in the 1850s that look better than what's happening right now in 2020. And so I mentioned that when I talked about some of the health disparities, I wanted to be able to also talk about some of the areas of discretion and how discretion can play a role in what we see within these disparities. When we understand that the vast majority of Black women who are dying during pregnancy and childbirth, that those deaths are preventable, there's discretion in that. I have a cousin who actually died shortly after giving birth. And her story is like so many other Black women who have almost died or died during pregnancy. She was experiencing symptoms. She expressed those symptoms. They were disregarded by the medical professionals who were caring for her, and she ultimately died shortly after giving birth. And so it's important to understand that what's happening within our system is when women are sharing their concerns and they're sharing their complaints, they're not being heard in the same way by their providers. I want to talk really quickly about schools and the disparities that we are seeing in Minnesota. Minnesota has some of the worst disparities when it comes to education. Our school discipline disparities are among the worst in the nation. In Minnesota, Indigenous students are 10 times more likely to be suspended than white students. Black students are 8 times more likely to be suspended than white students. And that disparity is a contributing factor to the opportunity gap that we continue to see play out within our schools in Minnesota. And when we think about those school discipline disparities and the gaps in terms of who's most likely to be suspended, who's most likely to be expelled, all of those decisions turn on discretion, right? So when administrators are deciding who they're going to expel or suspend, they have wide discretion in determining how they're going to address issues that they perceive within a school setting. And consistently, Black and Indigenous students are receiving discipline that is far more severe than their white student counterparts, even when you're looking at similar issues as well. If you ever get an opportunity to look at the work that was done through the Department of Human Rights, looking at school discipline rates and disparities, and looking at the common reasons that kids were being expelled from school, things, for example, like talking too much in class, or just sort of generally being disruptive, what we are seeing play out is that there are two different playing fields, and discipline is being divvied out differently. And so again, discretion is playing a big role within that. And what we know about the kids who are pushed out of schools, and that push out of schools can start at really early ages, including preschool. So we have 2, 3, and 4-year-olds who are being pushed out. Just this session, I was able to work on a bill to ban preschool suspensions. People don't often realize that preschoolers are 3 times more likely to be suspended from school than kids in K through 12. So when we're thinking about the school discipline, it's starting really early. And those kids who are pushed out, early, thinking about 2, 3, and 4-year-olds in preschool, they are less likely to finish high school, and they're more likely to come into contact with the criminal justice system. And so when we talk about the school to prison pipeline, an important part of that is the disparities that we're seeing within our schools playing out. And as we think about that school to prison pipeline, when we think about interaction with the justice system, officers also have pretty wide discretion as well when they're encountering individuals. If you're pulled over, an officer has discretion to determine whether they want to write you a ticket or not write you a ticket. And then we also think about the discretion within our courts. And so when we see these disparities playing out, it's important to keep in mind how discretion plays a role within those disparities. I'm going to play a very short clip here. And this is looking at racism and out-of-home placements. I work in a field, in the substance use disorders field, and right now in Minnesota and also within the United States, the #1 reason that kids are being removed from their home, typically alcohol or other substances, are the #1 reason that kids are being removed from their homes, which is a new trend. It used to be neglect. But what we're also seeing is that there are some huge disparities in terms of Indigenous families and Black families experiencing higher out-of-home placements for foster care. And just want to share a story of a young Black child who was placed with a family for adoption.
Because as many of you know, I have a biracial son. His name is Jude. And he is just, in my opinion, the most adorable little brown boy you will ever see in your life. As a mom of 5 boys, and one of those boys being biracial, I recognize that I'm going to have a different conversation with Jude than I do with my brown-haired, little Irish, very, very pale skinned white sons as they grow up. Because right now, Jude is an adorable, perpetually tan looking little brown boy. But one day, he's going to grow up and he's going to be a tall, probably sort of large, intimidating looking, maybe brown man. And my other boys are probably going to look like nerdy white guys. And so I realized that I'm going to have a different conversation with Jude than I do with my nerdy white kids. And that just made me angry. And many of you would say, that should make you angry, Abby, but it doesn't make me angry. You know why? Because I look at statistics over emotion, okay? Now, I'll tell you what does make me angry in a minute, but right now, I'm going to look at statistics over emotion, okay? Statistically, I look at our prison population, and I see that there is a disproportionately high number of African-American males in our prison population for crimes, particularly for violent crimes. So statistically, when a police officer sees a brown man, like my Jude, walking down the road, as opposed to my white nerdy kids, my white nerdy men walking down the road, because of the statistics that he knows in his head, that these police officers know in their head, they're going to know that statistically, my brown son is more likely to commit a violent offense over my white sons. Okay? So the fact that in his head, he would be more careful around my brown son than my white son, that doesn't actually make me angry. That makes that police officer smart because of statistics. Now, if he treats my brown son violently, more violently than my white son, that makes me angry. But if he's on more high alert with my brown son than he is my white son, that doesn't make me angry.
So as we think about, again, we talked about this whole idea of discretion and how discretion can play.
Because this is smart. Because.
And how discretion can play a role. When you begin to look at the data in terms of when kids are being pulled out of their homes, Black and Indigenous kids, in really high numbers, imagine being placed in a family where your mom believes that you're more likely to commit crimes. There are things that are seriously wrong within our system that this is happening right now. And so understanding, again, the challenges that we see within the child protection system oftentimes turn on discretion as well. And that discretion is resulting in disparities. Really quickly, thinking about employment and thinking about COVID, so many individuals in Minnesota have been impacted as a result of COVID. We had unemployment numbers that were looking like numbers that we're seeing during the time of the Great Depression. And with that, we were hit hard as a state, as most states were as well. But even within those numbers, there are disparities. Half of individuals, Black individuals in Minnesota that were working have been on unemployment. Half, 50%, 1 in 2. And when you compare that, those numbers of unemployment with white workers, the numbers are 1 in 4. So again, we're seeing disparities there. And part of the disparities is also looking at the sectors, because the sectors that were highly impacted, thinking about like hotels, thinking about some of those frontline workers. Not only have we seen sort of disparities in terms of like who's being laid off, and but we also have individuals who are working within areas where they are also at a higher probability of contracting COVID as well, because a lot of the frontline workers, that those are individuals that are people of color. And so another challenge that we've seen during this period that has been so tough is that, again, it's hitting certain communities harder than others. And when there are decisions to be made about layoffs as well, there are things that there are discretion within those. And within those discretion pieces, we're seeing that Black communities, the Indigenous communities, and other communities of color are feeling those economic hardships more so than other communities. Housing is another really space where we see intense disparities. There are disparities in home ownership. There has been a lot of data coming out in the last few months that also looks at things like appraisals, for example. There was just a research study that came out that is showing that Black families are experiencing appraisal situations very differently from white families, and that there are disparities in appraising houses. So Black families are having houses appraised at much lower levels. There have actually been families who have experienced an appraisal where within their home, it was clear that it was a Black family, and then they removed all traces that would show that they were a Black family and experienced significantly higher appraisals. And we're not talking about $10,000 or $20,000. We're talking about hundreds of thousands of dollars. Citi just recently, Citibank Financial Corp just recently released a very interesting report as well, looking at the economic costs of racism. And they're looking at that from the perspective of things like the mortgage market. They're also looking at it from not only that lending perspective, but also thinking about things like appraisals, thinking about access to capital for businesses, and what they were able to do within the research that goes back over 20 years and made comparisons between Black individuals and white individuals is to find that discrimination within the lending markets has cost the United States economy more than $16 trillion in the last 20 years. So when we begin to think about the impacts of racism, not only does it have sort of these health equity consequences, but there are also deep economic consequences as well. And we know housing and access to affordable, stable, and quality housing, it impacts health as well. And so within all areas of our system, we're seeing these very deep disparities that really need to be addressed. So this is my last slide I want to speak about, and then I would want to open it up for questions and discussions. But the work that we are talking about needing to be done within Minnesota and within the United States is really the work around creating anti-racist institutions. When I began to work on authoring House Resolution 1, declaring racism as a public health crisis, it was in the days following the tragic killing of George Floyd. And it was as I was reflecting in all of these different areas of life, we're seeing these deep disparities. We're seeing it in our education system. We're seeing it within healthcare. And in fact, at every single point across the lifespan, from birth to death, in Minnesota, Black and Indigenous individuals have they're dying at lower ages because of these deep inequities. And it was just a recognition that racism is not only making communities sick, it's also killing communities as well. And it's also having a really deep impact on our economy. And so we are faced with a very large task in terms of thinking through how our systems have been designed and how we can work together to create community-based responses to addressing the impacts of racism and moving the dial so that we can be working towards becoming anti-racist organizations. We know that those who are closest to the pain need to be meaningfully involved in having conversations around what those solutions are. Because when we don't have the voices of the people most impacted by the challenges that we're seeking to address, things are lost. And so one of the tenets of our House Resolution 1 is around meaningful community engagement and including those who are most impacted by the disparities and being part of the decision-making process around how we move forward. As part of the House resolution, we also created a House Select Committee on Racial Justice that's been meeting for the past several weeks. And the early sessions have been focused on informational sessions to really set the structure for what the issues are. And next week on Tuesday, October the 13th from 1 to 4, we have open public testimony where people can come in and they can share their stories, they can share their experiences, but they can also share their ideas, their solutions, the things that we as legislators need to be thinking about, the things that our full community needs to be thinking about, so that we can really begin to think about how we all work together to create community-based solutions to address the issues that are facing. And the issues are broad and wide and varied, that, as you can see from just this short presentation. It's not just one system, one issue. It is across our entire system. One of the things that we are, I think, facing right now, because we are in the midst of a global pandemic, and because Minnesota is feeling the effects of COVID as well, it has not been business as usual. And within this time period, it's actually a great opportunity to be looking at our systems and how they can be redesigned and how they can be reconfigured and how we can begin to work to assure that we are not perpetuating systems that have the negative outcomes, the inequities, the disparities that we are continuing to see. So as we think about our challenges within the school system, we're not doing school as we have traditionally done that. Here's a time, here's an opportunity for us to begin to think differently about how we're doing that. The ways that we deliver healthcare, here's an opportunity to address that. As we think about our commerce market, and we think about everything from homeowners insurance and car insurance, there are disparities at every level there, and there are concerns about racism within the commerce sector that has to be addressed as well. So with that, I will turn it over to you, Mark, and happy to field any questions and further the discussion.
Okay, thank you for that really important talk. I think we all really appreciate it and learned quite a lot, and a lot about how much work we have to do working together. So people can raise their hand. I'm going to allow you to talk. The first question coming in is from our division head, Diane Newmark-Steiner.
Can you hear me?
Yes.
Yes.
So Representative Richardson, thank you so much for your talk, and really for doing the work that you're doing, helping to declare racism as a public health crisis. And I loved how you framed things at the end, that really this is an opportunity for us to do things differently. So my question for you is, as a division of epidemiology and community health, we are really front and center in trying to address COVID and racism. And one of our goals is to get our work out there, to work together with the legislature, to really influence policy. So just as today you use data, you know, how we have lots of data like that. We have lots of faculty interested in these topics. We have many, many students interested. Do you have advice for us, or what advice do you have for really having an impact on policies within the legislature?
Great question. And, you know, I like to say that the best way to have an impact on policy within the legislature is to marry the data with a compelling story. The very first policy issue that I worked on when I was in law school, I was part of a task force looking at decriminalizing homelessness. There were a number of laws on the books that basically criminalized individuals for being poor, being homeless, and not having a place to go. And one of the laws that we were most concerned about was the state's vagrancy statute. And the state's vagrancy statute actually has its roots in Jim Crow laws after the Emancipation Proclamation and Reconstruction. What was clear was that chattel slavery was outlawed, but under the 13th Amendment, slavery could continue if individuals were incarcerated. And so the origins of the vagrancy statute was that if you were an adult with no legal means of supporting yourself, you were a vagrant and you could be arrested for just existing. And this was a law this was 2003 when I was in law school, that was still on the books here in Minnesota. And we actually worked with a group of veterans who had all experienced post-traumatic stress, had challenges with mental health issues and substance use disorders, and found themselves homeless. And as a result of that, when we were working with them to try to get this vagrancy statute repealed, the first time that we went to the Capitol, we focused on those stories. Here are people who have given their lives to protect us. It's our moral obligation to address this. And we didn't get as far as we had hoped. But when we came back and did the work of actually identifying the costs of no permanent address arrests, we spent a summer collecting data and looking at every no permanent address arrest. And we got the figures to figure out how much does this cost the police department, how much does it cost to house them in the jails, how much court time, and then brought that back with their stories. We were able to get the vagrancy statute repealed. So when those two things, the data and compelling stories, come together, that's difficult to dismiss.
Thank you.
Yeah, people can use the chat box or raise their hands for questions. Could you talk a little bit about the challenges of, I'm guessing there's a lot of challenges in working across the aisle. So many issues that are important to us in our society become political, unfortunately. And so what is that like, and how is that going?
You know, it's a really good question. And as a first-time elected official, as a legislator, you know, we're about 18 months in here. And in that first year and a half, I was able to get 16 bills signed into law. But the only way to do that here in Minnesota is you have to work across the aisle, because we have Democratic-controlled House, and we have a Senate that is Republican-controlled. And so I think, again, it goes back to the question that was just asked as well, because part of it is you need the data, you need the information to be able to identify what even is the issue, because it's hard to get to solutions if we're not going to sit down and identify that this is an issue. And that was one of the most important things, I think, with this House Resolution 1 declaring racism a public health crisis. The first step for us as a state is to, one, acknowledge that racism exists. Two, acknowledge that not only does it exist, but that it's harmful. And it's not just harmful to the people who are experiencing racism, it's also harming other individuals as well. It's harming our economy. And then being able to say that, knowing that something is deeply wrong, now how do we work with community to address it? Because we're not going to address it in a silo. And when I talk about the idea of like pairing the data with the stories, and why that is so powerful, is that because it connects the people who are closest to the pain of the issue. And that, again, makes it difficult to dismiss. So when you're talking about the fact that Black women are 3 to 4 times more likely to die during childbirth, and you can go through all of that data, and then you can bring the compelling stories along with it. One of the bills that I was carrying that hasn't made it across the finish line yet, I have a Dignity in Pregnancy Act, and childbirth and pregnancy. And on the House side, with those stories, there was unanimous consent. There's something that we need to do about this. It got lost within the COVID pandemic, but again, I think that that's really at the heart of working together, because there are a lot of issues that aren't partisan issues. No one should die when giving childbirth, and if it can be prevented, it should be prevented. No one is going to disagree with that statement. There might be differences of how we get there, but I think at the base, in terms of what people want, there isn't that much difference. People want clean water. They want safe schools. They want their kids to get quality education. We can have differences about the way to get there, but we all want good things for ourselves and for our neighbors.
Thank you. Yeah, that's really important. I mean, we have all this data, and it's painfully obvious what the data show, and we need to work together to communicate it to make a difference. Question from Rhonda Jones-Webb, who's on our faculty. Policies can be effective in reducing health disparities. However, policies that are poorly implemented may be less effective. Can you speak to how policy implementation quality affects health disparities or poor outcomes in marginalized populations? What is the role of institutional racism and policy implementation quality?
Really good question. And what we know is policy can be helpful and policy can be harmful. It can be both. And oftentimes there can be unintended consequences related to policy that you may not see coming if you don't have diverse perspectives at the table. One example of that is the mandated reporting statutes that we currently have in Minnesota, because there's some discretion that is built into the mandated reporting statute. So for pregnant women, if they go to see a provider, if they're using substances, typically that would be a mandated report to Child Protection. However, there are exemptions written in the statute. There's an exemption that if you're using alcohol, that the provider has the discretion to determine if they're going to contact Child Protection. If they're using marijuana, the provider has the discretion to determine if they're going to contact Child Protection. And so when this law was put on the books, the whole idea was, if women are experiencing substance use disorders, we don't want them to avoid prenatal care. So if they know that they can go to their provider and safely share, we're going to have higher use of prenatal care because they know that their provider can work with them and not necessarily report them to Child Protection. But how this has played out in reality is that with the discretion that has been built in, what we see is there's a disproportionate number of Black women and Indigenous women who are being reported to Child Protection. And then that, in fact, contributes to the increases of out-of-home placements of Black and Indigenous children. Again, it gets down to that discretion piece. So as we're thinking about building policy and how we can build effective policy that is going to be more helpful than harmful, that's why we need lots of different opinions at the table, lots of different perspectives at the table, because when you are legislating in silos with only your narrow perspective, things are missed.
There's a question from Tricia Alexander. I think you could unmute. Okay.
Hello, can you hear me?
Yes.
Yes.
All right, hi. I want to say thank you for your presentation. I really appreciated it. My question is kind of taking it to a larger scope. So I'm curious what your thoughts are in how to approach, these topics when we currently have an administration that kind of denies, racism as an issue, because I know you mentioned stating, first recognizing that racism is a problem is important before you can delve into this work, and using statistics and stories in combination is powerful, but I'm wondering if you've thought of any strategies that could be helpful when you encounter, having a national administration that actually denies that racism is an issue, and how to kind of go about being to go about reaching across the table in that sense?
Really great question. And I think that one of the tools that we currently have at our disposal, and being on this call with a number of you who are deeply within the data piece of this and the research piece of this, I think the data is part of helping us get there. When you look at sort of the economic costs of systemic racism, that is compelling. We want people to be moved by moral arguments. They're not always going to be moved by moral arguments, but there are things that I think from an economic perspective that we can shine lights on how much better outcomes could be if we had different policies. I mean, the fact, and for anyone who hasn't seen the Citibank report, I highly encourage you to read that. Because when you begin to think about sort of this disparity just between Blacks and whites, and the fact that they are estimating the costs of economic loss at $16 trillion over the last 20 years, that's just looking at Black individuals. It's not looking across the whole spectrum of people of color. And so there's this saying that, you know, Paul Wellstone had, like, when we all do better, we all do better. And it is patently expensive to have systemic racism within our systems. And for individuals who are fiscally conservative, for individuals who want to ensure that we are maximizing our investments in business and ensuring that those businesses can create jobs, because just thinking about that, you know, the losses, think about all the job creation that has been lost as well. And so again, I think that those are the stories that need to be told. And it's now we're starting to see more and more of these economic costs arguments that I think are going to help move us forward. The Federal Reserve is now talking about this. I will say it's long overdue. This House resolution is long overdue. All of this work is long overdue, but it's getting the attention now.
We have another question from one of our faculty, Kumi Smith. What is the Minnesota House able to do regarding defunding or eliminating police departments? Or will this always have to be addressed at the municipal level? And is that a good thing?
So in terms of the state legislatures, we don't play a role in how cities just decide to work within their police departments. You know, what I can talk about is after the tragic death of George Floyd, we worked on the Posse Caucus at the State House, the People of Color and Indigenous Caucus. We had a number of bills. We had 16 bills that we were pushing forward to address police accountability and reform. And those, I carried 3 of those bills that ultimately passed. 2 of the bills funded police departments, actually. One of the bills was an autism training requirement. We have had some tragic deaths of individuals on the autism spectrum, and when coming into contact with individuals with law enforcement. And so the bill would require that officers receive training on interactions with people with autism. The second bill that also funded the police was looking at mental illness training and increasing the number of hours of mental illness and de-escalation training. Many of you are aware of the tragic killing of Philando Castile. And one of the things that came out in the days following his tragic killing was the fact that the officer who had killed him had participated in something like 40 hours of warrior training compared with 4 hours of de-escalation training. The third bill that I carried banned the warrior training piece. And that warrior training really had this idea that as officers, what they were trained to do, and this line comes from an example of one of those trainings, as an officer, you should be courteous, but be prepared to kill every person you meet, man, woman, or child. So thinking about that sort of training happening, and then thinking about that interaction where Philando Castile lost his life, and the fact that this officer had gone through 40 hours of that kind of training compared with 4 hours of de-escalation training, really sets through some of the cultural pieces that need to be addressed. When we look at the individuals most likely to be killed in a police interaction, it's people with mental illnesses. They are the #1 demographic of individuals most likely to die. And then when you put a race lens on it, it's Black men with mental illness who are at the highest risk of being killed during an interaction. And so as we talk about what needs to be done and what needs to be addressed, it always comes back to the same thing. We need community-based solutions. Policing should not be something that is done to a community. It is something that should be done with a community. And if you are afraid that every person that you come into contact with is trying to kill you, if you're afraid every child that you're seeing is trying to kill you, if you're afraid every adult that you see is trying to kill you, how can you police that community together? You can't. You can't work with people that you're afraid of. And so the issues are extremely complex, but it also involves relationships. And so that I'm saying a lot, and there might be other questions, so I'll just wrap it up there.
Okay, so we have a few more minutes. If there are any more questions for Representative Richardson. Is there anything else you would like to share with us in the last couple minutes, or leave us with?
You know, I think what I would just leave people with as a reminder, next week, we have public testimony happening at our House Select Committee on Racial Justice. That's October 13th from 1 p.m. to 4 p.m. Individuals are able to sign up to testify. You can visit our Legislative Committee homepage on the House Select Committee on Racial Justice and reach out to our staff, Benta Kanta. All of her information is online. Testifiers will be given 3 minutes. And again, you can share stories, you can share recommendations. If you're not able to participate live via Zoom, there are also options to submit written testimony, and individuals will also have the option to pre-record a message via voicemail that could be shared during that hearing as well. We really want to encourage as many people as possible to participate within that hearing in one of those 3 ways. And I would just also, I think for some final words, we talked a lot about discretion today, and where and how discretion can be applied and how that can create disparities. And so I would just challenge everyone to think about, in the work that you do, that you are doing every day, where do you have the discretion? Where do you have the opportunity to move the needle on inequities or disparities? Are you a decision maker in hiring? Are you a decision maker in promotion? As we think about the different boards and advisory committees, who are on those committees? Where are those relationships? Who are you reaching out to? When there are research studies Do you have diverse perspectives? There's a lot that's happening. Technology is fast changing. We're talking about AI and AR, augmented reality. Do we have people of all, different races like participating, and what those designs are going to be looking like? So if you have discretion, you've got a role. And we all do at some point. So thank you very much for the opportunity to talk today.
Well, thank you. We can't thank you enough. This was really, really helpful, super important. And we're very fortunate to have you as one of our representatives. And we look forward to continuing to hopefully work with you and have you join us again in the future.
Thank you so much. I appreciated the time.
Okay, thank you.
Thanks.
Bye,
Bye.
everybody. Bye-bye.